As college students, we have all had days where we have been stressed out, mentally drained, or burnt out from schoolwork, and the thought about having to go to class puts a lump in our chest. More than 60% of college students have experienced at least one mental health problem, according to the Healthy Mind study that looked at over 300 campuses. Anxiety, burnout, and depression are common experiences for so many college students and should not be normalized. I personally have had days where I felt overwhelmed from schoolwork and studying but still feel pressure to attend class because of strict attendance policies. I am calling on the University of South Carolina's Faculty Senate to change the attendance policy from only verifying absences for severe medical conditions to implementing a policy allowing one excused mental health day per semester to protect the well being of students while maintaining academic standards. There are two reasons to change the current attendance policy. One being mental health affects academic performance, and our current rules create a policy gap, and the other being mental health excused absence policy would strengthen our standards and support the student well being. According to the American College Health Association, 75% of students reported psychological distress, which led them to having lower GPAs, missed assignments, and withdrawing from courses. At USC, the counseling services provide counseling for students in distress. However, the university website states that attendance decisions are left up to the professor for this reason. If USC prioritizes the well being of students through CAPS, the attendance policy should reflect that. Adding this policy would proactively prevent crises. Secondly, faculty may stress that mental health excused absences would increase absenteeism or reduce standards, but this policy would address those concerns and support student well being. This proposal would not be unlimited absences. It would be structured and applied through all the departments of the school. Some universities have already supported mental wellness by these policy changes, showing that this change can be implemented without lowering standards. For example, Inside Higher Ed said that UNC Chapel Hill implemented this policy for mental health breaks in 2024. These breaks were designed for students to focus on rest, and the administrators said that the policy has reduced stress without changing academic expectations. If a peer college like UNC has integrated mental health days to their schedule, then USC can adopt a similar policy. With that, mental health challenges are present for so many students on our campus, and it directs students' academic performance. When considering whether to change this policy, remember, USC already prioritizes wellness through CAPS, but the attendance policy doesn't reflect that. Additionally, this addition has benefited other school student success, so adding a limited structured mental health day policy would align with our goals while maintaining our standards and supporting the student well-being. I urge the Faculty Senate to consider changing this attendance policy, allowing an excused mental health absence per semester. USC can be proactive in student success and make sure students do not have to choose between their mental health and their grade.